Hey guys, what's up? Doing a new stream today. I had some problems with audio yesterday. Everything looks like it's working well today. So was trying things out again today. So Debbie, thanks so much for joining. Again, sorry for the bad audio. Hoping to get a few common questions answered today and that. So appreciate you guys. If you got any questions, you feel free to shoot them my way. What's up, guys? Hey, Carmen, Gabby, what's up? Nasrin, Joy, Debbie, appreciate you guys joining. If you got any questions, feel free to ask. Hey, Carmen. Hi, Ashley, May. Good to see you. Hey there. Hi, Anna. See you over there on YouTube. So I was explaining that in Acha, it's good to see you on YouTube as well. Thanks so much for joining. So no, I had work today, but fortunately I got off a little bit early. Only had a couple surgeries in the afternoon, finished up early, so that was nice. How's everyone's day going? What do you guys had a good day so far? I'm actually done for the week. I'm going to be doing a dermatology conference, ODAC, that starts tomorrow and goes through the weekend. So, yeah. So Carmen says she works in healthcare in Canada. Very cool. Thanks so much, Carmen, for. It's been a crazy last year. So I feel for you. Yeah, I wanted to just. Yeah, thank you so much. Thank you. Yeah, thank you guys for joining. Rebilia, user Purple, good seeing you guys. Izzy, Ari Bay, Christopher, Elizabeth, thank you. Carmen says she loves the videos, and thanks. Well, thank you guys for asking all the good questions. I appreciate it, and I'm glad to hear that you're really liking the videos. Really appreciate that. And then we got someone checking in from Connecticut. So, hey there. Good to see you. And so, over on YouTube, got a question that was coming in about acne skincare. So, this would be a good one to talk about. Let me just get this pulled up here real quick. Yeah, so so basically someone was asking about acne. So basically for acne, what we're going to do is at home, you're kind of limited. Sometimes you need a dermatologist help, but you could start off at first by using a good cleanser that's mildly keratolytic, meaning it kind of opens up pores and that. And then if you're using something that's also a little bit antibacterial, that can help you too. Because acne is essentially originally a clogged pore. You get some acne bacteria that lives on the skin, Cutibacterium acnes, and then when that gets blocked up and builds up, and then the bacteria is metabolizing the oils that your skin makes, it causes inflammation. So in this case, we want to basically open up those pores, prevent them from getting blocked, and we want to decrease the amount of acne bacteria that's on our skin. So benzoyl peroxide is a great option for that. So CeraVe makes a really nice one that's 4%, or you can, if you can't use benzoyl peroxide or you're worried about it bleaching the fabrics, then instead you can use salicylic acid, and you can use that anywhere in a range of 0.5 to 2%. Inculus makes a nice one, and then at bedtime, the real king of anti-acne is basically a retinoid. So something like either prescription tretinoin from your dermatologist, or you can get over-the-counter adapalene from La Roche-Posay or different. And you want to use those slowly. When you're starting a retinoid, you basically only want to use it maybe 3 nights a week. I tell patients Monday, Wednesday, Friday, use a pea-sized amount, and you want to treat your entire face. So treating acne is not a spot treatment thing. You have to treat your entire face because it can take like 6 weeks for a new acne bump to form. So you got to stop it ahead of time. But that's also why it takes so long to see good results. So once you get started on one of these regimens, it's going to take you about, I tell people, 6 to 8 weeks to start noticing the improvement. And then by 3 months, you should have good, steady improvement going forward. So don't lose the faith too early. Some redness and dryness are expected in the beginning. As your skin gets used to it, you may have to use more. You may have to end up using more moisturizers than you typically would. So I hope that answers your question, Atcha. That's a great question. So I'm going to get over here on TikTok and take a look at a couple things. Let's see. Can I use benzoyl peroxide during pregnancy? Someone asked you. You should not. Pretty limited. If you want an option for acne or rosacea during pregnancy, you can use azelaic acid. The Ordinary makes a nice cheap one. Best for women in the late 20s for wrinkle prevention. Well, the strongest thing you can do is use adapalene, which I mentioned for acne, but it also has a whole lot of other benefits. It can reduce fine lines and wrinkles. It can lighten dark spots. It can help stimulate collagen and kind of thicken up your dermis, which is the supportive layer of your skin underneath your epidermis. So that's the best thing you can do, adapalene at bedtime. If you want something a little bit more mild and gentle, and I actually recommend doing both, is you could use a good vitamin C serum in the morning. If you want to, also, you can add in like nice peptide serum at bedtime. Or that's kind of your best bet. Jasmine says hello. Hey, what's up, Jasmine? Proactive. I'm not a huge fan of it. I mean, if you look at Proactive ingredients, there's a lot of the same ingredients that we would recommend or that I've talked about, but I guess Proactive never was like one of the like mid-level marketing type situations. But I always am, it was very commercialized though, so I'm not saying it's a bad thing, but it's not something I typically recommend. I think there's probably cheaper alternatives, but for some people, I'm sure they just need a nice, simple, easy product to buy, and it's kind of their whole regimen, and maybe it's cheap and easy to try. But I think some of these options I'm telling you would work better. Sierra was using benzoyl peroxide 10%, and Sierra brings up a good point. The 10% benzoyl peroxide is very effective, but it can be a little bit drying for some people. So that's the only trouble with it. And there's been some research studies done on cleansers with benzoyl peroxide, and like a 4 or 5% benzoyl peroxide irritates less, but it is just as helpful for treating acne. So that's why the CeraVe makes a nice 4% one. I think Panoxyl makes a 5% one. Those are good options. Laser hair removal removes strawberry legs. It kind of depends, because some people can get a condition called keratosis pilaris, and it may not particularly help that. And usually when people mention strawberry legs, that's what I think of. So it may not help. I do know about morphia, but that's a pretty complicated skin condition, and I think it's best to talk to your dermatologist in person about that. So, see, we got Tactituru. Hyaluronic acid before or after Retin-A. I know the 20-minute wait before and after. So, yeah, so good point. So you're bringing up this idea of like you wash your skin and you get moisture on your skin. Similarly, if you're applying hyaluronic acid, because a lot of that's water-based, I personally apply it and right immediately after apply tretinoin. You do have to be a little bit more careful if you have very sensitive skin, because if you have your skin wet and you apply tretinoin, you definitely can get some more irritation. So if you don't have sensitive skin, I don't think it's a big deal. If you want to maximize or really minimize the side effects from tretinoin, you will wash your skin, allow it to dry, and then for 20 minutes ideally, and then you can apply it. But I would personally use the hyaluronic acid before. And generally what I say is, in the order of applying your topical creams, basically you want to go from thinnest to thickest. So usually start with serums, and then maybe do some, if there's thicker serums like the vitamin C sometimes have a little bit more consistency to it, then your creams, then your moisturizers, and then followed by that, then you want to use your like SPF and sunscreens and things. So SPF on top, but thinnest to thickest is the general consensus there. And I'm going to go back down to the bottom here on TikTok. So Ashley doesn't like Proactive. She's the esthetician. They're trying to get her to sell it. So yeah, it's always a challenge when you got somebody pushing you to sell something you don't like. It's a bit of an ethical dilemma. Dry skin for retinoids because it's less irritating. Matt says thank you. You're very welcome, Matt. Thanks for joining, by the way. Dela Cruz ointment, and I actually haven't used that. Asking what to use for psoriasis. There's not a lot of great over-the-counter options for psoriasis. If you have trouble in your scalp, you can use Neutrogena T gel, which is a tar-based product that kind of can help in the scalp. Sometimes there's an overlap with like a dandruff type condition called seborrheic dermatitis. So some of the patients do good with over-the-counter Nizoral 1% ketoconazole shampoo. You can get that at almost any store. So all of those things can be helpful, but usually got to see a dermatologist. Krista, it's good to see you. Hope Milo's doing well. And then hyaluronic acid, the ordinary before after retin-A. So before, we talked about that one. And Cowgirls Never Die. It looks like Anna hooked her up, so thank you, Anna. And then, so Jasmine Jam, what do you think about Skin Fix? So we were looking at that a little bit last night on the live stream. I wanted to stream again today because like the first, I think 13 minutes or something of the live stream, I have no sound on some of the other platforms. So, you know, we looked at it, and I do see it's quite expensive is probably my biggest reservation. And I haven't used the products personally. So maybe it's great stuff. I just haven't used it. Bellatero, a good filler for under the eye. So Bellatero, yeah, most of the under eye fillers are going to be your hyaluronic acid fillers. And Bellatero is one of those. So it's a pretty thin filler. I think that's a nice option for under the eye. Let's see. So let's see. So we got someone checking in from Wyoming, and we talked a little bit about psoriasis, so I hope you heard that one. But seeing a dermatologist and getting good topical steroids is going to be your best bet. But there's some amazing psoriasis medicines out now that are both oral or injectable. And for some of the injectable ones, I mean, it can nearly clear your skin completely. But it's not a cure. It's a fix that's temporary. Lactic acid, what is it for? So lactic acid is a nice, mild, gentle acid that can be used. We use it most commonly in like ammonium lactate. That's a moisturizer that we use for keratosis pilaris, or kind of the rough bumps that people get on their arms or on their thighs. But also if you have people with dry skin that's kind of pretty flaky and stuff like that, then you could do that. So thanks so much for the flame. Appreciate it. Pigmentation, which cream is better? So I'm actually going to drop a video on TikTok today, doing a TikTok video on some other options for hyperpigmentation. And in that, I'm going to talk about a few different things. I still got all the products here because I was recording them today. So I'll show TikTok first here, and then I'll show the other platforms. This is Faded. This is by a company called Topical. So if you have hyperpigmentation, this is awesome. And it's awesome because it has so many active ingredients in it. It has kojic acid, it has tranexamic acid, it has niacinamide, licorice root, and azelaic acid. So this is literally a single product that has 5 active ingredients in it. So it's really cool. It does not smell good. I will tell you that now. It doesn't smell good, but the smell does fade. So the smell does fade away. Some other things that can be helpful for hyperpigmentation, and they'll be in the video today if you want to check it out. But so these are both by Inky List. These are both by Inky List, and this is tranexamic acid and alpha-arbutin. So they're great options. You know, the alpha-arbutin kind of protects from you know, photo-induced hyperpigmentation, and then the tranexamic acid. This is being used, interestingly, now in medicine a lot more with cosmetics people, because it even orally, you know, you can, this actually comes in a pill too, which of course you'd have to do under the, you know, the very close guidance of a dermatologist because there's a risk with that. And I've even heard some people using it IV, which is kind of wild. I don't know if I'd ever do that as a as a doctor myself. But okay, I'm going to scroll back down to the bottom here so people aren't waiting forever. So Matt, you're welcome. And then we talked about the dry skin for retinoids. Let's see. So yeah, you guys can keep the questions coming. Kinder and Lex, I appreciate you joining. So dark spots, we just talked about. All of those. Cherry angiomas, those are inherited things from mom and dad. You can get them lasered off if you want, but you don't. They're not harmful. Oily skin, I would just start with a good cleanser. Basically, 14-year-old, that's pretty young and everything. So I would say start with a good cleanser. Let's see if I can turn the light up a little bit. I feel like I'm sitting in the darkness over here. It's too much. I don't know. Let's see. There we go. So yeah, 14-year-old with skin. So with oily skin, I would recommend using something like just the CeraVe foaming facial cleanser. It's really good at helping decrease oily skin. Sometimes counterintuitively, using a moisturizer regularly can help kind of decrease that oiliness of the skin. So while it's counterintuitive, that sometimes can help too. I would check that out. Products for comedonal acne, good salicylic acid cleanser. You can use adapalene at bedtime. Those are good. Vaseline, okay for keratosis pilaris. So it probably isn't going to make it go away. It's kind of more of a moisturizer or a protectant, where a lot of those are like hyperkeratotic kind of plugs in the follicles that KP is caused by. In that case, you may need something a little stronger like amlactin. And then on the other platform here, we got Ella asking a question. Ella M says, "Hi, I used Rosex for rosacea for 4 months, and as soon as I stopped, bumps came back. Can you do another course straight after?" So that's a good question. So I'm not familiar with the brand name. I'm not sure if you're in the U.S. I'm taking a look here. So Rosex. So that's metronidazole. Okay. So you can take so metronidazole or Rosex is a really, really common type of treatment for rosacea. It's an antibiotic. And Ella's asking, it sounds like she's frustrated because basically she's got rosacea. And like acne and like many other skin conditions, we still do not have a cure for it. So it's a tough thing. Now, some things we can help improve for a long time. I'm sure, Ella, as you probably already know, there are multiple types of rosacea. So you can have ocular rosacea, where it actually affects your eyes and you feel like a gritty sensation in your eyes. You can have vascular rosacea, which is just like more of blood vessels, and it kind of gives you the rosy cheeks or rosy, discoloration on top of your nose. You can get like papular or pustular rosacea, where you get actual pus bumps and that. And then there's rhinophymatous rosacea, which really only guys get, and that's actually where their nose kind of grows and gets real like bulbous and stuff. So the bumps are generally treated with like what you're describing, either topical antibiotics, oral antibiotics, and that. Sometimes we can maintain people on very low dose antibiotics. That's how we treat it here in the States. Like only 50 milligrams of doxycycline, and just keep them on that for some time. And you can actually stay on it. It's really not that harmful. You just got to have a doctor to help guide you through it and make sure there's nothing to worry about. For topical medicines, we keep people on Metrogel, which is our version of Rosex here in the States. So Ella's from Australia, so she's an Aussie. So yeah, so basically you got to treat it as you go along. There's probably not going to be a cure. For people that have vascular rosacea, sometimes you get laser done, and that's going to give you like a pretty nice improvement, at least for 4 or 5 years from that redness. But it's a little harder with the bumps. You're going to have to do something to control it, whether it's a topical or probably an oral antibiotic at the direction of your dermatologist. So great question. Thanks so much for asking. Cystic acne in 40-year-olds. So a lot of times we see, a lot of people's acne will go away, in their teenage years. But A lot of people say that to go away in their teenage years, but some people start getting more of it, and it can be hormonal or cystic, and they're deep and they're scarring, and so that's really really frustrating for people. And again, like we were talking about with Ella's question, acne doesn't generally have a cure per se, aside from isotretinoin or Accutane that could actually cure people permanently. So Kawar is using doxycycline and Epiduo Forte and not getting any better. So I would talk to your dermatologist and maybe see if isotretinoin would be good for you. I think that would be a nice option. Clear Light Crystal, thanks for joining, Bob, Chrissy. You guys are awesome. How do you get rid of backne scars that have been there for years? You'd probably have to talk to somebody, dermatologist, about some procedural options like doing microneedling or lasers, those kind of things. Difference between melasma and age spots. Well, I think generally, age spots are a little bit more well defined, and they kind of, they actually come up as dark spots that are pretty isolated. Where melasma sometimes can be, it can occur like pretty much anywhere in the face, but it tends to come up in these kind of like poorly demarcated patches, meaning you can't really feel any texture on the skin, but the edges are kind of feathery and you can't really see where it stops, where it fades off, and that kind of thing. And then just a lot of times talking to the patient, a lot of people with melasma are going to be maybe a younger female that was taking birth control, or maybe they got it when they had their pregnancy, and things like that. So that's something I'd see a skin doctor for and see if you get some help. So dark spots, the thighs, armpits, the knees, and elbows. So this sounds like a common condition called acanthosis nigricans. And while we talked about a lot of the other hyperpigmentation, like over-the-counter treatments that you can get, this is a different thing. This is actually caused by thickening of the skin. And some people have diabetes or metabolic syndromes or insulin resistance, and they'll tend to get it in the areas you described. So there's a few different treatments for this. Adapalene, which we talked about for acne and anti-aging, can help. But the most common thing I use is a gentle moisturizer with lactic acid in. It's ammonium lactate, amlactin. So you can find that probably in any store. It's very inexpensive, but it's going to take months to see an improvement. So it's not a quick thing, but it can definitely help. So someone else is asking about melasma. This is Sheila. So how to cure melasma. So that's the first thing about melasma and hyperpigmentation. It's generally not cured, it's treated. So the biggest thing you have to do is you got to be using sunscreen every single day. SPF 30, ideally tinted sunscreen. If you're not doing those things, then you'll never really stand a chance, because every time your skin sees the sun and you're out, even if you don't get burnt, you're going to get dark spots coming back again. It's going to be real frustrating for you, even if you're doing everything else right. So that's a tough problem. You want to probably use a couple anti-hyperpigmentation medicines. Maybe you want to use the alpha-arbutin or tranexamic acid that we talked about, or you could use azelaic acid, which can help with acne and rosacea and dark spots. So any of those are a good start, but a lot of times people do need help from the dermatologist with more prescription treatments and things. So Bottom asks how I'm doing. I'm doing really good, thank you, and I hope you're doing well too. So I'm going to scroll back to the bottom here. So we talked about creams for pigmentation. Glow Pro microneedling. I actually am not familiar with Glow Pro itself. If it is a home microneedling device, I don't generally recommend that. Yeah, it looks like it is a home microneedling device, couple $100. So some of the problems with this is that, sometimes people are putting stuff on their skin and they're microneedling over it, and you can drive some of those medications and topicals into the skin, and you can get inflammatory skin conditions that can be really difficult to treat. That we call them granulomas in medicine. So that's part of the problem. The other thing is some of these products, they're not made really well. Like, I haven't used this, but sometimes the needles themselves are kind of jagged, and then you're rolling kind of that microneedler across your face, and it's kind of puncturing the skin at an angle, which can cause some issues. So Um, yeah. So I wouldn't recommend home. So on one of the other platforms, Sahara asked, is it normal to have upper back acne due to weightlifting? I'm a female, a couple months of started weightlifting, no supplements or pre-workout. I noticed my back acne appeared. I stopped weightlifting the last 3 months due to the gyms being closed and back is clearing up. So that's definitely a good test to see if really the workout was the cause of things. It sounds like it's pretty suspicious for it, right? I mean, a lot of times we'll see it, like football players, stuff like that. You can get some degree of like acne mechanica, which is, where you're getting acne in areas that rub and that kind of thing. So, your back's on a bench, for example, the other factor of just sweat or possibly like bacteria in the gym, all these things play a role. A lot of it has to do with irritation. A lot of it has to do with bacteria. I think something that would be really nice for you is there's a product called CLN. Let me get it real quick here so I can just show you. I don't know exactly where you're at in the world, but this is CLN, and I'm going to show the other platform here too. So this is the body wash, and it's actually got sodium hypochlorite in it, and it's a really, really nice, like kind of antiseptic cleanser, but it's used as a body wash. So you could use that to wash your back. They also, if you feel like you need more, you could even use their acne wash, which also has salicylic acid in it. So the biggest thing you can do is just shower right after, and then either use your CLN or you could potentially use the like a benzoyl peroxide wash. I think any of those are nice options for you. So I hope that helps you, Sahara. So Havana asked if they can see the product again, and yeah, you certainly can. So it's called CLN. It's pronounced clean. So clean body wash, and again, the sorry, it's not probably in great focus there, but CLN body wash, and it's sodium hypochlorite's the active ingredient. So, and you can leave it on your skin about 1 or 2 minutes, and then you just rinse it off with just clean water, when you're getting out of the shower. So, and Sahara's in the U.S., so I know you definitely can get this. It's a little bit expensive. I think it's like $30, but it's super worth it. I think I really like their products. It was a good idea, great niche for them to get involved in. And so we got Madison here, we got Claudia. Appreciate you guys. Jeff's here. And then we got a patient asking about granuloma annulari on the body. Steroids didn't work, or creams. Any advice? They say it's stress. Well, I don't think that stress has really been tied to granuloma annulari. It's not a harmful condition. It can be sometimes tough to treat for people, and there's a lot of different treatments you can do for it. But if the topical steroids didn't work, you might be able to get steroid injections in the dermatologist, but that's something, of course, you want to talk with your dermatologist in person about. Vitamin C, and use it before hyaluronic acid. So vitamin C and hyaluronic acid are amazing products. Vitamin C, I'd say, is definitely in my top 3. Hyaluronic acid's in my top 5. You could use the hyaluronic acid before vitamin C, and they're both really important. Hyaluronic acid is great because basically it holds about 600 times its weight in water. So when you put that on your skin, it holds a really nice layer of like hydration on your skin. So when your skin's hydrated, immediately you actually get decreased appearance of wrinkles and things like that. It's not really a long-term treatment for it, but it makes your skin look great. It makes it look dewy. It reduces the appearance of wrinkles. And then your vitamin C is an antioxidant. So it's definitely the top 3 things I recommend. You can use L-ascorbic acid between about 10 to 15%. I have used some stronger vitamin C's that are over 20%, but they're a little bit more irritating. But I think all those are really, really nice options. And you definitely use the hyaluronic acid before the vitamin C. Is there anything else? Is there anything else to help facial hair growth due to thyroid problems? So I assume you're asking probably about excess facial hair growth. So there are some topical creams like ephornithine that can help prevent hair growth on the face. And there's also oral medications that you could see a dermatologist about that would block testosterone to stop hair growth in the face. But for patients, if you're looking at the safest and best option for long-term improvement in that, I would actually recommend looking into laser hair removal, because you're going to pay that much if you're buying some of these expensive creams, and it's going to give you a permanent result, where if you stop the creams, it's going to come right back. So over exfoliation definitely can cause acne flare-ups. So Havana is using ordinary red face peel. That's the AHA BHA peeling solution, and still have texture in the skin between uses. Yeah, so it's all about, it's slow and steady. You want to get your skincare regimen right. Perfect skin is not a reality for people, but these type of things like these acids can help. So just make sure you're moisturizing well. Make sure you're using a gentle keratolytic to help kind of smooth out that texture. And I would keep up using your acids. Acne-prone skin cleansers that won't break you out. I'm using right now. I'm using the CeraVe cream to foam cleanser, and I absolutely love it. So that would be a good option for you. You want to look for oil-free and non-comedogenic on the label. Sarah, you're very welcome. Regina says hi. How you doing? The body wash does not personally cause me dry skin. If you used their acne cleanser, it has salicylic acid in it, and it can be a bit drying. But that one is quite gentle, actually. So Clear Like Crystal says thanks. And so I really appreciate all you guys checking in. You can find me on other social media platforms as well. So if you want to check those out, you can. I really appreciate you guys for checking in, all the great questions. I was going to do a 30 minutes today. Had audio problems yesterday, and I wanted to get on here and answer some more questions. So I appreciate you guys. If you have questions, feel free to drop a comment, and we'll definitely try to answer those in the comment section for you. So thank you guys all so much. We're at almost 200,000 on TikTok. So remember, there's a giveaway going on. When I hit 200,000, I'm doing a giveaway, $250 skincare products. And all you got to do is just drop a comment on the giveaway on my IG. So you can check that out. If you just drop a comment, it'll be randomly selected from the comments, and I'm going to draw that when I hit 200,000. So I think we're almost 1,000 followers away from that. So I hope you guys win. All right. You guys have a good day. Thank you guys all so much for watching. I appreciate it.